The investment case for mental health is a country-specific assessment used to provide the economic rationale for investing in mental health. The investment case for Lebanon was conducted by the National Mental Health Programme at the Ministry of Public Health, with support from the World Health Organization and funding from the French Development Agency. This analysis also showcases the national impact that scaling up investments in mental health treatment has on the long run. Evidence for the government and relevant actors. Advocacy piece to present to policymakers and donors. The economic analysis consists of 4 steps: estimating the economic burden of mental health conditions, assessing the health impacts of interventions, costing of these interventions, and analyzing the return on investment. The analysis uses 3 main tools: the World Health Organization Mental Health Economic Burden Model, the World Health Organization OneHealth Tool, and the Return on Investment Model. The burden of mental health conditions can be viewed as an iceberg, with the top and visible part representing direct costs, such as how much the government spends on mental health care. In Lebanon, there is no earmarked budget for mental health. However, these direct costs are estimated to account for $13 million. Data from 2015 indicates that the expenditure of the Ministry of Public Health on mental health conditions is accounted for around 5% of the ministry's total expenditure on health. The bottom and largest part of the iceberg represents the indirect costs, including productivity losses due to absenteeism, presenteeism, and premature death. These hidden costs constitute most of the expenses, mainly due to absenteeism, and account for more than $514 million. The total economic burden of the mental health conditions on the Lebanese economy is $528 million annually. This burden is equivalent to 1% of the country's GDP in 2019. The Lebanon investment case exercise assessed the impact of investing in the mental health packages of care, which include interventions targeting the following 6 mental health conditions: depression, anxiety disorders, psychosis, bipolar disorder, epilepsy, and alcohol use dependence disorders. The results of the investment case for Lebanon provide evidence that scaling up the coverage levels of these interventions between 2022 and 2042 is an opportunity for the country. This scale-up will have a significant impact in reducing the adverse health, economic, and other consequences of mental health conditions through treatment-based interventions. As treatment rates are scaled up in the population over time, the number of healthy life years gained and cases averted increases remarkably between 2022 and 2042. Clinical interventions for anxiety disorders, depression, and bipolar disorder incurred the highest estimated costs because of the highest prevalence of these disorders and because of the high cost per case for severe cases requiring intensive care and support. With respect to both the increased productivity gains and the social value of health over 20 years, investing in all the packages for these mental health conditions has shown to be beneficial and cost-effective. The process of conducting this investment case followed a rigorous process including involvement of all relevant national stakeholders. As such, the results are based on a thorough analysis of the contextualized OneHealth Tool data related to Lebanon, including data on prevalence of disorders, treatment coverage, service utilization rates, and others. In summary, the economic burden of mental health conditions in Lebanon accounts for 1% of its GDP in 2019. A figure that may even be higher given the economic crisis the country is going through. By investing in the suggested evidence-based interventions, we could save over 1,750 lives, avert over 374,000 disease cases, and return over 143,000 healthy life years over the next 20 years for the populations in Lebanon. By acting now, these investments will contribute to the overall development of Lebanon, with positive ripple effects across society and to accelerating economic growth and social development.